Chabot.
Thank you, Mr. Chairman. Ms. Boss, I'll begin with you if I can. Back in 2003, I was the lead sponsor in the House on the Partial Birth Abortion Ban Act, which went all the way to the U.S. Supreme Court. President Bush signed it into law. It was appealed, went to the U.S. Supreme Court, and it was upheld in the Supreme Court. I've also been a longtime supporter of the Mexico City policy, both in this administration, and I'd like to thank President Trump for that, and under President Bush's administration. So if I could ask you this, has the administration's Protecting Life and Global Assistance rule impacted your ability in any way to provide life-saving treatment and other health services to women across the globe?
The short answer to that would be we have had some additional administrative requirements, but we have our own internal policy, again, as a pro-life organization, where we neither receive nor give funding to organizations that provide abortion. So from a practical operational standpoint, in our programs, I'm not aware of any impact, but there has been some administrative, slight administrative burden. We have to ensure our partners are complying so that we can continue doing the work that we want to do.
Okay, thank you. Ms. Crocker, let me turn to you for a different question. A few Congresses back, Senator Rubio in the Senate and myself and some other members here in the House, it was a bipartisan bill, passed legislation, the Girls Count Act, which in essence encouraged the State Department to work with other governments to make sure that children, especially girls, were actually registered upon their birth. We've seen time and again where if especially girls aren't registered, they basically can disappear into all kinds of horrific circumstances. They can be trafficked, international gangs. People don't know they exist, and so they can be sold off into horrific circumstances. So, excuse me, could you discuss how birth registration or lack thereof could impact access to health care for women and girls?
Thank you for the question. It's not actually something that I'm expert in or have knowledge of myself. So I wonder if I might ask if my co-panelists might be able to come in and address this question. Perhaps our witness.
Somebody else wants to handle it. I'm happy to hear about it. Yes, Ms. Bosch.
I'm happy to jump in, Mr. Chabot. I've seen some of our birth registration programming in Kenya. It really is vital, and thank you for championing that issue, because if any child doesn't have a birth certificate, the lack of access to education, to health services, it's really as if that child doesn't exist. So it's a critical piece. It's something we're trying to grow our programming and just recognizing the barriers that follow that child if they don't have that simple piece of paper at the beginning.
Thank you. And then one final question, similar to that, Senator Rubio over in the Senate and myself and others here in the House pushed a bill called the Protecting Girls' Access to Education Act, and it was also signed into law by President Obama, which seek to promote education in conflict zones, in conflict settings. In your work, do you see a correlation between access to education and access to health care?
Absolutely, and we found that the lack of access to formal education really does increase vulnerabilities, especially for girls. Being in school actually helps protect them from gender-based violence, early marriage, early pregnancy, so it's really critical. Right now in places like Bangladesh, we're working in Cox's Bazar, there is not formal education. We're working with UNICEF on some informal mechanisms, but it's really an important issue in these protracted crises, working with displaced populations. Access to formal education is a huge need.
Okay. Thank you very much. Mr. Chairman, I yield back.